Hello, everybody. I know that was a quick lunch, but we talked yesterday about today was going to be a day of heavy lifting. So this morning, just to recoup, there is a method in the way we organize this. This morning, the panel discussed conformity assessment pathways for respiratory protective devices for non-traditional user groups, but who are still workers. And then the next panel is going to try to go through that same process, but with two slight changes. It will include looking at conformity assessment for both respirators and other options for the public, i.e. these barrier face masks. But here the population under consideration is the public user. And I'm going to turn it over to Dan Shipp, who is retired as formerly leader of the International Safety Equipment Association. This is a space Dan knows well. Thanks, Dan.
Thank you. The title of this session, as you can see, is Assessment Pathways for Respiratory Protective Devices and Other Options for the Public. In a way, I think much of this workshop has been heading in this direction. Looking at a lot of the questions and a lot of the comments that have been made, I think we'll get some of them answered now. As we all know, the world's a very different place since this workshop was first planned. 6 months ago, I don't think anybody thought that everybody in the world would be wearing a mask, for example. So we don't want to lose sight of the original scope and intent of the workshop. We can hardly ignore the reality. Masks for public use are no longer an abstraction. They're a fact of life. So how do we define these masks? How do we take what we know about respirators for occupational and professional use, masks for infection control, and the characteristics of the threats to public health, whether they're environmental threats or viral threats, and use that knowledge to set baseline requirements for community masks? How do we assess mask performance against those requirements? Who conducts that assessment? What entity regulates it? These are the questions we'll put to our expert panel. We have a very expert panel, I believe, to address these issues. Jim Johnson is a recognized authority in the field of respiratory protection and has been for many years a leader in development of voluntary standards for respiratory protection. Emil Den Hartog is Associate Director of the Textile Protection and Comfort Center and Director of Graduate Programs in Textile Engineering and Textile Chemistry at NC State University. John Salata is Deputy Director of the NIOSH National Personal Protective Technologies Laboratory. We're going to start with Jim Johnson, who will set the stage and define the challenge of assessing performance of regulatory protective devices for public use. Jim?